My symptoms were not traditional cardiac or heart attack symptoms. I can't say that there was an elephant standing on my chest or that my arms were tingly. It was like a severe sore throat that worked its way down my esophagus. And I, at that point, started thinking that perhaps this was a cardio event occurring.
When you're having a heart attack, part of your heart muscle is being deprived of oxygen. And when that happens, your heart muscle begins to die. The quicker we can restore blood flow to your heart, the less chance of that heart muscle dying.
If you are having a heart attack, you need to get treatment as soon as possible. And that means going to the closest hospital that is available to you.
If there's any suspicion, I tell people to call 911. It's not the kind of thing that you want to play around with.
We have had patients who are brought to the emergency room by their family and collapse with a rhythm problem that would have killed them had it happened 5 minutes earlier in the car.
If somebody is having a heart attack and they call 911, an ambulance will arrive, and once the EMS unit arrives, they will evaluate the patient and get an EKG or an electrocardiogram as soon as possible.
It takes probably 20 to 30 seconds to forward that 12 lead to the hospital, where a physician can also review it and determine if a patient is having a heart attack.
That EKG gets transmitted to the hospital, to the emergency room, to the physician, and simultaneously everyone is alerted. So that patient could go straight from the ambulance to the cath lab and without even stopping at the emergency room. The amount of time that we're actually saving with our EKG system can be anywhere up to 40 minutes. And when you're dealing with cardiac tissue that is dying off by the minute, that's huge.
Within 60 seconds, an EKG was performed, and the physician attending the EKG procedure informed me that I was having a heart attack on the right side of my heart. And again, almost immediately, a team of cardio specialists were preparing me for the next step, which for me was the removal of a blood clot.
Research has shown that if you can get your treatment within 90 minutes, your outcomes are going to be a lot better. So that's the recommended door-to-balloon time.
When the patient comes in, that's the door time, and how long it takes to open up that vessel, then that's your door-to-device or door-to-balloon time.
The national average is about 70 minutes, and we are averaging around 45 minutes for a door-to-balloon time. So we're significantly underneath that number. In our best cases, we've been under 20 minutes.
From entry door in the emergency room to actual catheterization into the heart was no more than 20 minutes. And of course that can be life-saving because time is everything.
Goshen Hospital is committed to providing the best possible heart and vascular care. We actually have the same or better equipment than almost any place in the nation, and that includes the really large centers.
What really sets Goshen apart is their collaborative care with all the different physicians. You get interventional radiologists, cardiologists, and surgeons all working together.
We're in the 98th percentile of emergency cardiac care in the nation, and people need to understand that we are a small hospital, but we do rank nationally for our cardiac care.
The emergency cardiac care at IU Health Goshen Hospital is top-notch. It's phenomenal. There's nothing out there close to it.
I was just amazed by how this team worked together. I had no idea that sort of care was available at Goshen Hospital.
Here at IU Health Goshen Hospital, we have a 24-hour-a-day, 7-day-a-week heart catheterization program. So for our area, if you're having a heart attack, you want to come to us, and we're going to get you taken care of.